This is the Whole Care Network. Helping you tell your story one podcast at a time. The following CareLab podcast does not provide health or medical advice. All content is provided for information purposes only. Listeners are encouraged to speak with their healthcare provider for specific healthcare advice and are wholly responsible for the outcome of implementing any tips or information presented.
Hello, everyone. Welcome to CareLab.
Welcome to CareLab. It's CareLab Day. I'm so excited to be here with you both.
Yes, very, very excited. We have with us here today a very, very exciting guest. We've wanted to have this type of guest on for a long time. I'm going to do a little quick introduction here for Dr. Joy Poskozim. Okay, so Dr. Joy Poskozim is the dental director for several nursing care facilities. She educates staff as well as providing care to nursing home residents. She goes by Dr. Joy normally. She makes house calls in and around the Chicagoland area, and she's been in private practice for 25 years. She practices integrative health general dentistry at her office on the northwest side of Chicago, has been performing dental procedures on the homebound for over 16 years. In 2017, she earned her dentistry in long-term care certificate from the University of the Pacific Dental School, her fellowship with the Special Care Dental Association of Geriatric Council in 2018, and is certified as a dementia practitioner as of 2021. So you can see why we are super jazzed to have her on here. Dr. Joy, thank you so much for being on CareLab. We are delighted to have you.
Thank you so much for having me. It's a pleasure.
So
I have so many questions.
I have so many questions. I was actually
But I know we had to start with the icebreaker.
Yeah, we do. Okay, let me start with the icebreaker. So many questions. All right. So it is the new year, though. Obviously, sometimes people have resolutions, some people don't have resolutions, and I don't necessarily need to know what your resolutions are, but I would love to know from both of you, what are your feelings towards New Year's resolutions? Are these helpful? Are they stressful? Like, what do you think? How do you feel?
So for me, I like to consider resolutions as goals, right?
Mm-hmm.
Things that we can strive for, things that we can do, obtain within reason, right? So, for example, in my dental world, when I see patients, at this time, and they don't always floss, right? It's a big deal, right? It really should be a 4-letter word, but it's not. It's it's 5. But it's a matter of, well, okay, can we start with flossing, on the weekends when we seem to have more time? Can we begin to think outside the box? Like, for example, for me, I floss in the car on the way to and from work. I got one of those, from the dollar store, one of those pre-strung flossers, and there I am, flossing away.
Can I just say that I do the exact same thing? And I'm so glad to hear a dentist say that you do it.
Yeah, that's awesome. Well, we're women, we can multitask, right? So
That's
yeah,
right.
I firmly believe
That's
that.
right.
But I bring it up to my male patients as well. But it's discovering ways in the new year, for the new year, to better ourselves, right? Because oral care is self-care. And by taking our care of ourselves better, through just little, increments. Okay, so now I'm flossing on the weekends. Now I'm flossing on my commute. Okay, so maybe now you work from home. So, and breakfast is not your first meal of the day. You have, something maybe around, maybe around brunch time, right? Somewhere between 10 and 1. Okay, fine. Brush then. I'm cool with that. The whole purpose of brushing our teeth is to get rid of the crap that we don't swallow, right? So that our oral bacteria don't get to it. So for me, resolutions is about implementing new things on a reasonable basis so that we can, do better for ourselves throughout the year. That's me.
That's a really good answer.
Thanks.
It is.
Mic
Nothing
drop.
to follow up. I have nothing to say.
It's all
I was
good.
gonna say something a little bit similar because I know sometimes New Year's resolutions stress people out, and I've never been
Yeah.
one to be like, oh, because the calendar has changed to January 1, now it's time to start a new habit. To me, it's like if I recognize I'm doing something that or not doing something that I want to do, then I'm gonna just start then and just change it. So I don't need to wait till a trigger. So I've never been one to set goals. Or set like actual New Year's resolutions. But I am going to co-opt this thing that my husband has been doing for a long time, which is he sets an intention for the year, like a theme. And so, like, if the theme is, I'm just making some up. Like, if the theme is like self-care, let's say, then every time he gets a chance to make a decision about something, he's like, does this fit the theme? I'm trying to make sure that I'm focusing on self-care this year. And so all the things that happen over the year is just like, I'm going to keep the same theme. So he takes a real intentional effort at thinking about like, what does his life need over the next year, and then makes that the theme. And I was like, I've always admired that. So I'm going to try to do that myself.
I love that. I'm going to try to do that too. That's fantastic.
Yeah. So your husband stole mine. So that's kind of that's sort of how I view it. I'm not like a big goal setter.
You're an OT who doesn't set goals. Are you telling me this?
I was actually going to say, like, have I ever set a SMART goal for myself as a New Year's resolution? SMART, dear listeners, being like,
set goals.
Like specific, measurable, action-oriented. There's a timeline. Is it realistic? It's a SMART goal.
Yes,
I don't do that actually do that kind of thing in small increments. For example, like in business, I might set myself that kind of goal to follow. But in terms of New Year's resolutions, I'm really kind of the same as your husband. I try to think of it more as an intention. I love the idea of the new year as a fresh start and having a moment in time to reframe things and say, okay, whatever happened before is done, whether it was good or bad. I have this choice right now to set a new intention and move forward in a way that's going to create like meaningful, positive change. And so sometimes that my intention has been to make sure that I was like being more present with my kids, not trying to do work at the same time that I'm with my children. Maybe it's maintaining clear like work life boundaries. So saying like after this time, the phone's not going to get picked up or whatever it is. Or maybe it's, something to do with, I'm like, for example, what your husband saying, like, how am I going to take better care of my own health or wellness or something this year? But I think having something to sort of, to your point, frame the year around so that what your focus is. It's the same as having an organization or a practice. You have to know what your values are. You have to know what your focus is so that when you're making decisions, when all of these different choices are coming at you, you can say, does this choice align with what my focus and what my values are right now? Or does it not? And that makes it a lot easier, I think, to make like healthy decisions that move you in the right direction. But yeah, so same thing, intention.
I love it.
Intention, yes.
So I think that's a good segue, though, into what we're going to be talking about here. I just want to say that it has been my intention to have a dentist on CareLab right from the beginning because I love, as I was just telling Brandy before the episode, I love talking to dentists. It is one of my favorite things because you know so much about so many things. I think dentistry is really undervalued in our healthcare system. And like for me, both as a person as well as an OT, the value of like good oral hygiene, it's so important in our overall health and wellness. Can you start by just talking about that? I realize that's like a big deal, but
no, and absolutely. So what is the purpose? I mean, when we're brushing our teeth, right? Let's just start from the very beginning. Let's just start with brass tacks here. When we're brushing our teeth, what are we brushing off?
Plaque,
bacteria.
Plaque. We'll start with plaque, and there are 3 ingredients to plaque.
Ooh.
I love this so much already. Oh my gosh.
I don't know what the 3 ingredients of plaque are.
Neither do I. And I love talking to dentists.
So the 3 ingredients to plaque are bugs, poop, and food. Oral bacteria, bugs, oral bacteria, right?
Okay.
Poop, because they're living creatures too, they excrete, and excess foodstuffs that don't get digested, right? I'll start with the poop, because when we have morning breath, and we can have the best oral hygiene in the world, and we can still have morning breath. That morning breath is literally the poop that we're smelling. It's
Hold
the
on a second.
bacteria. No, it's true.
If nothing else gets people to brush their teeth, if you won't brush your teeth and floss after hearing that your mouth is full of poop, then
Literally.
I can't help you. No,
Right.
no one can help you, right?
I can't. You are a lost cause.
You are a lost cause.
I'm also just hang up my my mirror and Explorer right now. Just
Okay. Okay. I'm sorry. Continue. Poop.
Yeah, no worries. But yeah, so that's what we're smelling is the oral bacteria's poop. And then excess foodstuffs. I think one of the reasons why the paleo diet has gotten to be so popular is that because we're going back to basics when it comes to food and nutrition. But from a dental perspective, I love the paleo diet. I can't maintain it, but I love the paleo diet because our salivary enzymes have not kept up with our modern processed food diets, right? So unfortunately, our salivary enzymes can't really break down or emulate the foodstuffs that we're consuming, aka, okay, I'll just mention the one that I love so much, pretzels. I'm addicted. It's my crack. So I love pretzels of any kind. Doesn't matter. Insert name here. Yes.
Yes.
So, but the problem is that it's processed, right? So the salivary enzymes have a really difficult time breaking all of it down and making sure that we're swallowing all of that. Okay. Even if we're consuming it, if I'm consuming it as a snack, even worse, because I'm, maybe drinking a little bit, but I'm not eating anything else with it that can bind to it for me to swallow. Okay. But the problem then is that, well, the oral bacteria will take over, right? So the oral bacteria, what is carbs broken down to? Sugar. So, and sugar bugs, right? I mean, for kids, we tell our kids this is the reason why we're brushing your teeth. We want to get rid of the sugar bugs, right? Well, one of the reasons why carbohydrates, they are great for an instant spurt of energy is because the carbs literally are starting to break down. Digestion starts in the mouth. So the carbs are broken down in the mouth, and then the bacteria are like, woohoo, brunch, and then so they start eating that. And if we're eating something sticky or chewy, like a Starburst or whatever, then that that sticky stuff will stick to our teeth, and the oral bacteria are like, yay, but they're dumb too. So they're gonna eat that coating on our teeth, right, from that sugar. But then they'll also begin to permeate into the tooth, saying, oh, what's this? I'm going to start eating this. And guess what that is? A cavity.
Enamel.
Right?
Hey there, it's Amelia. Listen, I am so thrilled to have a great resource like Ask SAMIE as part of the CareLab team, and here's why. It's a game changer for aging in place because it makes it so simple. All you do is ask. Just type in your question or even tell SAMIE what the problem is and get tailored solutions. Everything from innovative adaptive equipment to comprehensive resources. It's a great way to become more empowered, to live more independently, and to live with greater confidence. And my favorite thing about how Ask SAMIE works is it's deeply rooted in dignity and practicality. So whether you're a fellow therapist, a care partner, or someone who's seeking solutions for themselves, visit www.asksamie.com. We're going to link it in the show notes so you can find it there. Start making home more accessible today. Now, back to the show.
So a cavity is breaking, a cavity is the bacterial invasion or bacterial infection of a tooth. So we're brushing off the stuff that are, salivary enzymes that we cannot break down in our mouths to remove any source of food for our oral bacteria. And when we're brushing our teeth, it's really about, staying ahead of that bacterial growth. right? We want, as long as we're staying ahead of that bacterial growth, it's famine for them, not feast, famine for them, then we can maintain a very healthy environment in our mouths. And how we treat our mouths really affects the rest of our body, and how we treat our bodies really affect the rest of us. So what's really affects our mouths. So another thing that I can mention too, so that's the teeth part of it. Gingivitis is chronic inflammation. And as we all know now, chronic inflammation wreaks havoc on our immune systems, right? The last thing I want my immune system fighting for is for my gums, right? I want my immune system fighting for my heart, lungs, and brain, right? My vital organs. So, and I tell this to my patients all the time. It's like, look, when we are brushing our teeth, we are literally preserving our immune system and keeping it strong so we can do the battles that we don't have access to, that we can't help support, right? And so chronic inflammation, really bad. Chronic inflammatory diets, chronic inflammatory, mouths. We don't need it. We don't want it. And we know the end results. Diabetes, right? Unfortunately, one of the dementias, these things we now know, and, this research has been defended several times over, that by taking care of our mouths really does help improve the overall health of our bodies. How's that?
So that's awesome. And
This is
that only
amazing.
adds to more questions that I have. And I already
So
started
good.
with questions.
Yes.
So one of the things you just said that stuck out to me was that brushing our teeth and oral care is prevention for our body, and it's helpful for and then that's so valuable and important. But also, do you think that that is the reason why dental care is separated out from like our health insurance, and that it's underutilized? Like, people are told all the time, go see your primary care doctor. We start with primary care, then you go do everything else. And dental has felt like, and also you should probably go see the dentist twice a year. I don't feel like it's like this is a thing that you're supposed to do. And do you think it has to do with the fact that it's very preventative and that people don't always see the problems until later?
Yes to everything you said. And I was having this conversation yesterday, actually, as a matter of fact, with one of my patients, and it was really interesting. I think part of it too is our codes that we use. In medicine, they're diagnostic codes, right? For dentistry, they are procedural codes. Why? I think, personal opinion, is that because when I do a filling, which is a procedure, that is a code, and I have now cured that tooth, the problem has been solved. This is not an ongoing thing. So when the codes first started coming out, they were marked or designated for an end result, for a procedure that has now been completed. A root canal, tooth fixed, crown, tooth fixed, denture, done, right? So, and there's different prices for different things, and some, things like dentures take more time than others, right? But I'm not coding every single time I see that patient for the next step of the denture. It is one code. And it takes, for some people it takes 5 appointments, for some people it takes 3 appointments, depending on the type of denture, so on and so forth. But the bottom line is we code for each procedure we do, not for the diagnosis. And I think that really does make a difference, because diagnostically, I can tell a patient that, you've got chronic gingivitis, and you probably, because you have diabetes, should probably be brushing 3 times a day, to the point where the American Diabetes Association recommends that those that are living with diabetes should be seeing their dentist 3 times a year. But these are recommendations. These are suggestions. These are not things where I can show on and literally, they're not prescriptions. Well said. Yes. And and so therefore, they and when I hand them their invoice, shall we say, it's not diagnosis with a code to that. It is literally just the procedure, and that makes it just very almost like it's very business orientated versus health orientated. Exactly.
Yes.
You come in, I fill your tooth, you're gone. right? And I think therefore that's one of the reasons why I think there's such a disconnect between medical and dental, because we look at things differently. And I think that might even ring true for, for ophthalmology as well, for vision, right? You come in, you've got problems with your eyesight, they fix the problem, you've got glasses, yeah, woo, you're done. Versus medicine, where these people are living with chronic conditions, so they're coming in for different reasons, and they're living with this problem. The only thing, the general population globally are potentially living with is gingivitis. And it's very difficult for people to wrap their heads around that, because very similar to diabetes, it's asymptomatic, right? It's not a problem until it becomes a problem. And what is a problem with gingivitis? Namely a medical condition, and there's still not that strong enough bridge for people to really realize that. That's why these podcasts are so important. But number two, it's like a tooth loss, right? The gums get weak. They recede from the source of the gum. Gums like a clean environment too, but they're also very patient. So, this chronic condition can last for decades before there really is a problem. And then all of a sudden, the thinnest part of our jaw is the lower front teeth. So I see a ton of patients in my long-term care facilities with partial dentures that are hitting the lower front teeth, because those are the teeth they lost first, because those were the dirtiest teeth. They're flatter, they can collect more versus a curved surface like a molar, so on and so forth. So the problem, I think, is that thinking of gingivitis as a chronic inflammation that people are living with, it's going to take a long time for people to really grasp that. And also for the medical field to consider gingivitis to be serious enough for them to say, and now here's my order for you to go see your dentist.
So all of this, I think, is mind-blowing for me on two levels. One, just like the education that you delivered, a lot of which, like, I didn't even necessarily know or think about those things, even though I've always, like, been a strong advocate for oral care as part of overall health. Like, that stuff is mind-blowing. But then on the other hand, it blows my mind that we don't think about these things as so deeply connected. It's like your mouth isn't part of your body. No, your mouth is the first part of your body where your food goes, and your food is, like, essential to keeping you alive. Like, all of this is so deeply connected.
And I'm going to cut you off really quickly, because I'm sorry for that, but I have to tell you, I'm the last person called when someone in one of the homes is beginning to have failure to thrive, right? They're beginning to lose weight. Okay, fine. Do the blood checks, they're, whatever, but, they're no longer eating. Okay. So
because their mouth tastes like crap.
Yeah.
Number one, but number two, what kind of teeth do they have? What's the quality of the teeth? And a problem that I see a lot is that when the nurses admit someone, they are not looking in the mouths. And another thing we need to focus on too is that there's a difference between an oral exam and a dental exam. A physician, or in the medical field, they're going to press that tongue down and they're going to look straight in the back, and they're going to be taking a look in the oral pharyngeal area. Fantastic. That's great. The throat. Awesome. I can do that too. I can screen, right? I can screen for, issues with the adenoids or whatever. But for me, I'm going to be looking at, what are they eating with? Because this really is going to affect their care plans. If they've got a partial denture and they're holding that thing in by, one clasp and a ton of denture adhesive, you're right. Absolutely. The food's going to taste like crap because of all that denture adhesive. But number two, can they really be chewing and eating a regular diet? Or should they be on a mechanical soft, or should they be on a puree diet? It starts with the mouth. And you're absolutely right. I am the last person called, even though the first area that we should be focusing on is the mouth. Let's start there, see if there's a problem, because I guarantee you the mouth was not looked at upon admission. And then maybe we need to adjust the care plan. Granted, maybe they haven't had, a CBC Chem 7, whatever. They haven't had, a full panel of blood work up for a long time, and that should be taken care of as well. Let's review the blood sugars. Let's review their LDLs and HDLs. Maybe they are not feeling well enough to be eating appropriately. But for me, it's really, but now we're waiting for those tests to come back. And now, so it's been 3 months. since they've, begun to lose weight, and they've lost, let's say, 20 pounds, and now I'm called in, and I'm like, well, here's the problem. There's an abscess on the upper right side. This person, is in pain. And this is,
I
I'm speaking of somebody who is, nonverbal, mid-stage, let's say
Yeah.
Alzheimer's. Yeah.
I love so much that you brought up this issue of failure to thrive, because it's something like OTs get called in fairly frequently for failure to thrive issues. And one of the first things that so often we go down these really complex paths. And to your point, of course, we want to run the blood work. We want to do all these other things and do a full check. But doing a full check, that means that we should also be looking at the most simple, obvious answers. And a lot of times we assume people with failure to thrive are not hungry and have no appetite, when in fact, it has more to do with their dentition, with their oral motor skills, with their ability to get the food into the mouth, or even their cognitive ability to process how to eat that meal. Like, there are so many levels of nutrition that we just completely set to the side that are often actually the real genesis of the problem and are things that we can solve. Like, you get a dentist in there, you get an OT in there, you get a speech language pathologist in there, and all of a sudden this person doesn't have failure to thrive anymore. But we
Exactly. Yeah.
ignore that so often in going down just like this one medical pathway, which, again, to your point, we should do that. We should rule out all the options, but let's not rule out the most simple,
Starting
obvious
place.
answers. Mm-hmm.
Yeah.
I mean,
No,
and you
it's
can even
totally
see
true.
this like in acute care. This was one of my biggest pet peeves. Like, as an OT in acute care, your goal is to help people get back their ADLs, right? And the first thing everybody's talking about is walking to the bathroom. That's good. We need to walk to the bathroom. But the last thing that gets talked about? Brushing your teeth, right? And like, nobody's teeth get brushed in the hospital unless somebody initiates doing it. And if they're not capable, the patient is not capable of initiating that, then some other clinician or somebody has to like be like, here is a toothbrush and let's brush your teeth. And so much crap comes out of there. And like, how can you eat
Yeah.
when your mouth is full of grossness and you don't taste anything? Your taste buds are covered with stuff. It's like, nobody's dealing with that, even though that's the first place for intake of everything: intake of air, intake of nutrition, output of
Inspiration
sound, and
pneumonia. Yeah.
exactly. So, yeah. CareLab listeners, it's Brandy, and as the founder of a platform made to make aging in place easier for everyone, I knew it would be incomplete if we did not have education, especially for caregivers. So whether you're a family caregiver or somebody who trains a whole organization, Higher Standards caregiver training videos are for you. I'm so proud that we were able to partner together with Amelia in order to provide these to you because they're easy for everybody. You get great occupational therapist-led training on topics like transfers and how to care for someone as they age, or maybe as things change when you have Parkinson's. So no matter if you're the loved one who doesn't know exactly what to do next because things are getting different, or if you're a professional who trains caregivers that go into the community and you need some quality education, you get both from Higher Standards Caregiver Training. And you need to check them out at higherstandardscaregivertraining.com.
Yeah, no, I completely agree with you. And there's been so many studies, both on the medical and on the dental realm, in the dental realm. So like medical monies or dental monies, where hiring a dental hygienist at a hospital would make so much sense. If nothing else, they're taking care of those in one of the ICUs or all of the ICUs, right?
Mm-hmm.
I mean, it would
Yes.
make so much sense to hire a hygienist. Has it been done yet? No. And it's incredibly frustrating because, these people potentially are suffering from bacterial pneumonia, aspiration pneumonia. What are they aspirating? They're aspirating oral bacteria, and so this aerobic bacteria that cause cavities get into our lungs and they have a free for all. They have a field day. They're loving this environment, right? And I was telling this yesterday. Oral bacteria are very migratory. They're not sedentary. They like to move around. And if there's overcrowding, they're going to find another place to live. and this is a potential problem, and we've seen it time and time again. The studies are there. Oral bacteria is a main cause of bacterial pneumonia, especially for those that are sedentary, especially for those in acute care in the ICUs, and still nothing is being done about it. Another thing I will say about having someone, an ancillary, maybe a certified nursing assistant, or somebody is going to be brushing their teeth. They're only brushing their patient's teeth because they either themselves have had a problem dental wise and they want to pay it forward. They've had a loved one where they had a dental issue in the hospital, and now they're paying it forward because they learned something from that experience. Or they had a prior patient who demanded a toothbrush and wanted to brush their teeth, saw what the problem was, and then once again is now, paying it forward again to their other patients. But when push comes to shove, there's really not enough time, I feel, and please correct me if I'm wrong, for the caregivers to be doing everything they're supposed to be doing, and then on top of it, taking the time to pat the hand, ask, tell show do, I'm going to be brushing your teeth now. I'm going to start with the upper right. And being, and doing this for them, there's not enough time in the day. The ratio of caregiver to patients, no matter where you are, and I go into some really nice places. They've got cocktail hour every Friday.
Mhm.
I mean, it's
Mm-hmm.
it's a deal, right? I mean, you walk into these places and it looks like a hotel. But, when push comes to shove, what is the medical care like? What's the overall care like? And the ratio is poor, so poor that, they're more concentrating on making sure that their blood sugars are good, and making sure that, the 18 medications that they're on are all being, modified and all being appropriated during the day,
Mm-hmm.
making sure they are achieving their ADLs. Are they going to the bathroom? Are they going to, are they sitting in something? How often should we be taking care of this patient? Just for those basic things. And the mouth 100% of the time gets overlooked in those situations. So, yes, I could not agree with you more. And I think a really good way of solving that problem is hiring hygienists. And the hygienists, let me tell you, they are eager and willing and ready. They would be thrilled to be a part of a hospital team. And yeah, it's still, I don't know what it's going to take. I can't even name one hospital that has a hygienist that will be, that do rounds, so to speak. Yeah.
I want to pivot this over a little bit because I think, talking about having better oral hygiene and hygienists in the hospitals would be, I can't even imagine what the
Mm.
outcomes would look like if we had that. I definitely believe that we would see much, much better healthcare outcomes just having that required and intensive and daily oral care for folks in those situations. But there's also this whole group of folks who live in nursing homes or perhaps homebound who also have a lot of trouble accessing dentistry and having good oral care and oral hygiene. And I know that's an area of your practice. And so I wanted you to talk a little bit about that and the importance for that particular population as well.
You got it. So when it comes to as as we age and as we become homebound, eventually at some point we're all going to be living, someplace, right? We're either going to be choosing to stay in place, or we've chosen now to live in an assisted living, skilled nursing, memory care facility based on our needs and our wants, right? That being said, when it comes to, as we age, our well, okay, let's start medically. A lot of women have osteopenia or osteoporosis, right? So the bones become brittle, right? And then there's frailty involved. Guess what? Teeth and bones are cut from the same cloth. So the teeth will become brittle as well. And you'll start to see in older people, especially in the front teeth, these vertical lines in their teeth.
Mm.
And those vertical lines are called craze lines, CRAZE, craze lines. And they literally are superficial fractures of the teeth. No one's done anything wrong. It's not bad dentistry. The teeth are clean. But it's because, I think personally, once again, anecdotally, that someone should that woman should probably have a bone density test if they haven't already. Because if the
Mm.
teeth are beginning to internally or externally fracture, what's going on with their skeleton? What's going on with their bones? And that should be tested, and potentially they need to have some kind of medication for that. Um, to help promote, bone strength, and obviously OT and PT would be fantastic to help in, for overall strength. But, we can see a lot of things in the mouth that are signs and symptoms of what's going on in the rest of the body. And those craze lines are numero uno because they're right in front. Anybody can see those lines. So that's a problem. So what happens? Teeth will chip, teeth will break. Um, People are no longer able to, because of diabetic neuropathies, because of osteo or rheumatoid arthritis. They're having a difficult time now to take their partial dentures or their complete dentures out of their mouths. And if the caregiver hasn't been told, or I see a lot of times too, where the person that I'm treating is too proud to say that they can no longer do that. And they'll say, yes, 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 I'm doing it. I'm doing it. Well, I'll take one look in their mouths and no, that's obviously not happening. So I'll ask them to take it out for me. And, and then there's the rub, right? That's the problem. And so the caregiver is there, or even more importantly, a loved one is there, a family member is there, and they're like, Mom, why didn't you tell me? Right? And because, they're embarrassed, they're too proud. They know they're aging, and
Nobody wants
no
to
one wants to
say that
say
they can't
that,
do what they
right?
used to do.
Exactly, exactly. And so then, I show the loved one, or insert person here. I will show them how to do it, and then I can take them out. The problem though is that now, if they haven't been taken out, those clasps that are holding, like a partial denture, for example, a removable partial denture, bacteria will generate around that. And now I see new decay that wouldn't have formed if the person was still able to take their partial dentures out. Or let's go the other extreme. We'll go to someone who's suffering or living with Alzheimer's, and they forget that they have dentures in their mouth, and they just don't take them out. They totally can. They're physically able to, but they just don't remember to. They forget. And that becomes a problem too. And the end result is the same, where you can start developing these cavities around the teeth. So a lot of times when I am called into a regular home, it's because yesterday, for example, I re-cemented 2 crowns back on, one for one person in one area of Chicago and then another area. And fortunately, there was nothing wrong with the tooth. There was nothing wrong with the crown. It was just the cement gave way. These crowns have been in their mouths, for decades. And the weakest link for all crowns back in the day, not so much anymore, but back in the day, is the cement. They just lost its adhesiveness, its ability to hold on. So I cemented those crowns back on, and everything was good. The idea of, not having the ability though to truly have those, that the care on a daily basis to be brushing the teeth. I really try to educate the loved ones, the caregivers, to think outside the box. For example, when it comes to someone living with one of the dementias, I learned, becoming a certified dementia practitioner, that having an activity that they've been focused on, let's say eating a meal, right? Then follow it immediately with another activity. Follow it immediately with another, with something else for them to do. They can help maintain that focus, retain that focus. So they're having dinner at their dining room table. Immediately, they're done with dinner. They've had some water. Now we're going to immediately afterwards brush their teeth. They've already been focused. We're not going to wait until 9 o'clock at night. We're not going to wait until they potentially are beginning to sundown, especially as the days are getting shorter. That time starts earlier and earlier. They're going to have their last meal, let's say at 3 o'clock, because the family knows better. That's a good time that they can eat. Immediately brush their teeth then. Now you're done. Now you don't have to worry about it. Teeth brushing does not have to be done in the bathroom. Or, if they're in their comfy chair and they're watching TV, and they've had lunch, with the TV table in front of them, whatever. Fantastic. Remove that. Bring in the toothbrush. Have them brush their teeth, or you're brushing their teeth in their general convertible, comfy chair. This way there's no failure. There's no fear of falling. Right? There's no, because they're unstable on, they're holding on and they're trying to brush their teeth, or they can't even see themselves if they're in a wheelchair. The mirror is not low enough, or on the design of the bathroom, there's no way that, if they're in a wheelchair, they can't access underneath the sink, right? So they can't even get themselves to the sink to be able to spit out. Forget all that. Forget that nonsense. Have that napkin across them, so they don't get spittle on them, and they can brush their teeth right then and there. Keep it simple. It's easier, much easier on the caregiver. They, the person that, has to have their teeth brushed, for them, or, are in this situation, my patients, it's a lot easier for them too. They don't have to go anywhere. We're not disrupting them. We're not disrupting their routines. We're just adding something on to something that they always do. And and by explaining, those things to them, it's kind of like an aha moment. Why didn't I think of that? Because you've got so much other things to worry about, so many other things to
Sure.
worry about. Let me be a resource for you. Let me help you and coming up with ways that are easier for your loved one while we're still maintaining oral health as long as we can.
That was like so there's so many gems there, and I want to
So
like
good.
go back a few steps because like I
Sure, I'm
just
sorry.
really want to like draw the connection that you just made to if you see crazed lines, which all of us
Yes.
can see,
Yes.
that means there's likely bone density issues everywhere else. And what happens when we have bone density issue everywhere else? A little fall or a bump, even or a hard landing into a chair can cause a fracture. And what did we talk about a few episodes ago about hip fractures and what the
Mm-hmm.
outcomes of those are so bad, especially after a certain age period. And so it's like this stuff matters a lot. And I think we sometimes are like, yeah, if you don't brush your teeth, your breast stinks. That's inconvenient, but not big deal. Like the things are a big deal, And so like, I just, there's so many times that you've said this in different ways throughout this podcast episode. I just want to like highlight that like your dentistry, because it's part of your body, is connected to your body and it can either help you or hurt you. And so you should pay attention to it. I remember the first time I recognized that somebody came to me because I worked at a neuro outpatient place. So we only worked with patients who had some kind of neurological issue, and they had a stroke because of a dentistry, like because they had bad dentation. And so, like the reason they were seeing me was because of that. That's how come they ended up with a stroke, and I didn't even realize that it was that connected, like that directly connected. And so I just want to make it plain and clear for all the listeners to know that like there are direct correlations to healthcare and outcomes based on what you actually can see. We can't see what's going on inside our bodies unless you got machines, right? But you can see this, and so this should be one of the things that should be triggering all of us, especially as caregivers, because you can be the advocate for that.
Yeah, the number
Absolutely.
of people that I've treated on neuro ICU who have abscesses in their brains that started from abscesses in their teeth that migrated to their jaw, like plenty of these. This happens way more than you think, and you just don't know about it because you don't hear about it all the time. But it is so important to understand how these things are connected. Dr. Joy, as I said, I love talking to dentists, and I love talking to you, even more than I love talking to regular dentists. We would love we would love to have you back again for more episodes, because I think there are so many things about oral care and dentistry and how they connect to the body and function and overall wellness, and especially like senior cares and senior care and caregiving. We could go down so many different pathways. Don't want to take up all of your time this morning, though. Thank you for being here and for being so generous with your time and your knowledge. It's been absolutely fantastic.
Thank you so much for having me. I would love, yeah, we didn't even talk about abscesses. Oh my
Oh,
gosh.
I
Shame
know.
on me.
This is what I'm saying. Like, I'm thinking we got to have you back, and we got to talk about like just dentures. Like, we could do a whole
Oh,
thing on
please,
just
can we?
denture.
I would
Yes,
love that.
we would love
Yeah,
that
yeah,
too.
yeah. I would love to do that. Yeah, and then how I even got into this in the first place, and that
Yes.
was a
Yes.
mind-boggling experience as well. So yeah, so no, absolutely, please have me back. But this has been a pleasure. Your questions were absolutely fantastic, and thank you for allowing me the time to explain things. And you've been very generous with your time and having me on. So this has been an honor and a pleasure.
So if people want to find you and connect with you directly, how can they best connect with you?
Email is really the best way. So I'll give my email address. It's my personal email. It's J as in Joy, V as in Victor, P as in Paul, Dent. So it's my initials, JVP Dent at Gmail. Feel free to email me. I'm on my phone all the time. And then I would please consider me a resource, and I will be more than happy to answer any of your questions. Send me pictures. Hey, you got a question about one of your clients. I can't, I can give you suggestions. I can't diagnose in different states, but I can be like, you know what? Yes, this is a situation where a dentist is going to be the most helpful, and let me help you find one in your state.
That is super generous of you, and I really appreciate you for one, doing that, and two, being on the show, and three, coming back. So we can't wait for it.
Yes,
thank you.
Definitely can't wait for that. We'll go ahead and link your email if that's okay with you. We'll link it in the show notes too.
Please do.
So to make it easy for folks, if you made it all the way to the end of this episode and you enjoyed it, please, dear listener, make sure that you are liking, subscribing, leave us a review to help make sure that the podcast is widely accessible to all the people who can benefit from it. And make sure that you join us right here again next time on CareLab.
Bye, everyone.
Bye.
This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.